All right, today we're diving into something that a ton of people experience but is still so misunderstood: social anxiety disorder. We're going to break down exactly what it is, what's going on in the brain, and most importantly, how it's managed. Let's get right into it.
I mean, does that sound familiar? Your heart is just pounding, your hands are shaking, your mind just totally empties out. That feeling is such a powerful place to start because, let's be real, most of us have felt some version of that before. But here's the million-dollar question we're tackling today. Where's the line? When do those normal butterflies in your stomach cross over into something more, into a clinical disorder that actually gets in the way of your life? So, here's our game plan. We'll start by defining what this really is, then we'll look at the brain science behind it, cover the signs and how it's diagnosed, and then jump into treatment and why all of this really, really matters. Okay, first things first, let's draw a really clear line in the sand. What is the official difference between social anxiety disorder and, the everyday jitters we all get? So here it is, the clinical definition. Now, I want you to focus on two words here because they're absolutely key: disproportionate and impairment. Disproportionate just means the level of fear is way, way bigger than the actual situation warrants. And impairment, that's when the fear literally stops you from living your life. Maybe you turn down a promotion because it means leading meetings, or you skip a friend's wedding to avoid making small talk. And this slide right here really lays it all out. Normal nervousness, it's temporary. It shows up before a big speech, and then it fades away. But social anxiety disorder is a whole different beast. It's persistent. That fear can hang around for weeks before an event, and it makes you want to just avoid the situation entirely. So let's get into the why. What is actually happening up in the brain that flips the switch and triggers such a massive response to what someone else might see as a totally normal social event? Well, what it boils down to is this. The brain is sounding a false alarm. You've got this part of your brain called the amygdala. Think of it as your internal threat detector. In social anxiety, it's way overactive. It's like a smoke detector that goes off every single time you make toast. This kicks your whole fight or flight system into high gear. And on top of that, an imbalance in chemicals like serotonin makes it even harder to calm things down. So the brain ends up treating a dinner party like a life or death situation. And it's important to know that this isn't a one-size-fits-all condition. It really shows up in two main ways. There's the generalized type, where pretty much any social situation can trigger that fear. But then there's the performance-only type, which is much more specific. It's tied directly to things like giving a speech or playing an instrument in front of people. Okay, so we know what's happening on the inside, but how does that internal false alarm actually look on the outside? Let's break down the key signs into three big buckets: psychological, physical, and behavioral. So psychologically, it's an absolute storm of worry. There's this intense, overwhelming fear of doing something embarrassing and having everyone judge you for it. And this can lead to something called anticipatory anxiety, where you're not just anxious during an event, you're dreading it for days, maybe even weeks beforehand. And the body absolutely responds to all that mental stress with very real physical symptoms. The whole fight or flight thing kicks in, causing your heart to race, sweating, trembling. And check this out, blushing is a really key clinical clue here. Why? Because it's a visible, totally uncontrollable sign of just how intense that internal stress response is. And finally, all of that leads to changes in behavior. To deal with all the internal turmoil, people will just start actively avoiding social situations. And when they can't get out of them, you might see things like poor eye contact, or you'll find they spend a massive amount of mental energy just rehearsing and replaying conversations in their head. Okay, so with all these pieces in play, how does a clinician put it all together to make a formal diagnosis? Especially when so many anxiety conditions can look alike. How do they make that definitive call? Well, the diagnosis is based on a specific set of criteria from what's called the DSM-5, which is kind of the official handbook for mental health pros. The big things are the fear has to be persistent, we're talking 6 months or more, and it has to cause that significant life impairment we talked about earlier. And of course, they have to rule out that it's being caused by something else, like a medication or another condition. This table is so helpful for telling these conditions apart. Just take a look. With social anxiety, the core fear is all about being judged negatively, and the anxiety is tied to specific social situations. Now compare that to panic disorder. The core fear there is the fear of having another panic attack, which can feel like it comes completely out of the blue. And then you've got generalized anxiety, where the worry is just everywhere. It's about all sorts of things, not just social stuff. Okay, we've spent a lot of time on the problem, so now let's pivot to the solution. And here's the really good news. There are incredibly effective, scientifically backed ways to manage social anxiety disorder.
The first-line treatments are a really powerful one-two punch. First, you have cognitive behavioral therapy, or CBT. This helps people learn how to identify and challenge those negative thought patterns that are driving the fear. The automatic assumption that everyone is staring at you and judging you. Then you combine that with medications like SSRIs, which help regulate serotonin in the brain, basically turning down the volume on that false alarm system.
There are also some other tools in the toolkit. For that performance-only kind of anxiety, a beta blocker like propranolol can be a game changer. You take it before a big presentation, and it helps manage those physical symptoms like a racing heart. And a really important note of caution here. While drugs like benzodiazepines might seem helpful, they're generally only for very short-term use because they carry a pretty high risk of dependence. So let's wrap this all up. Why is it so incredibly important to recognize this and treat it? What happens if it's just left to go on unmanaged? Well, the potential complications are really serious. The constant stress and isolation from SAD can spiral into other major issues. We're talking about things like depression or even substance abuse, as people try to self-medicate to get through social events. It can genuinely hold someone back from reaching their potential at work or in school, turning what could be a manageable condition into a lifelong roadblock. So if you remember just one thing from our time today, make it this simple formula. When you see those three things together, an intense fear of scrutiny, plus actively avoiding social situations, plus those physical symptoms like blushing or a pounding heart, you should definitely think social anxiety disorder.
And that really brings us to our final thought. We've broken down what this disorder is, how it works, why it happens. But if understanding is always the first step, what's the next one? For the person experiencing it, for their friends and family, for all of us. Thanks for tuning in.